All right. Good afternoon, Indianapolis moms. I am Kate. I'm the owner of Indianapolis Moms, and today I'm excited to share with you Dr. Halter from Hancock Health. So thank you so much for being here with us today.
Sure. I'm really happy that you guys have me.
Will you share a little bit about yourself before we go ahead and get started?
Sure. So I'm Dr. Halter, and I'm a pediatrician with Hancock Pediatrics in Greenfield, Indiana, and this is at Hancock Regional Hospital.
Well, thank you. I apologize. It's Dr. Halter. I apologize for that. My last name is Baumgartner, so I get that often.
Yeah.
So I have a few questions I want to go over. And this year, as we enter cold and flu season, we know that things are going to be a little bit different than they have been in the past. So let's just jump right in. And as we enter cold and flu season, like we have briefly discussed, we know that we're going to have the added stressors of COVID this year. So
certainly,
what are some things that families can do to keep their families healthy this year?
Well, I think that some of the best ways to even prevent other illnesses, colds, flu, as well as COVID, are to continue to do some of the hygienic measures that we've been hopefully practicing throughout most of 2020 right now. And those things would include things like continuing to use good hygiene, washing hands, using hand sanitizer, social distancing, wearing masks, avoiding public spaces. You know, just to share a bit of a story with you, last flu season in 2019 to early 2020 was a rather, we started seeing flu cases just before Christmas, and we continued to see children test positive for influenza right up until March. And the shocking thing was that once COVID really hit and the schools were shut down, we at that point really stopped seeing influenza as well. As using appropriate hygiene and masks and hand washing that not only prevent the spread of COVID, but prevent the spread of other illnesses as well.
So basically those good hygiene skills, keep those up.
Absolutely. Absolutely. Yeah.
So when we're looking at cold versus COVID, you know, with a bunch of my mom friends, we were talking about this. We said, this is kind of the game we're playing, you know, is it a cold or is it a COVID? So what are some things or symptoms families should look at when determining if a COVID test is necessary?
Tough. That is a tough question. And it's something that even the medical field is really challenged with right now, trying to distinguish the symptoms of COVID from other illnesses like a cold, like the flu, or even allergies for that matter, because they can all really mimic each other. I think, you know, there are a few symptoms that do seem to be very specific to COVID. The biggest one is going to be the loss of taste and smell.
Okay.
For a child, that can be very difficult to describe, especially for a young child. But for an older child or adolescent who is complaining of that loss of taste or smell, I think that alone is enough reason to consider the diagnosis of COVID. But the other symptoms, from body aches to fevers to a cough to congestion to a runny nose to a sore throat, those can be seen with a cold, those can be seen with influenza, and those can be seen. Certainly, allergies kind of stand out a little bit uniquely because allergies are often distinguished by the lack of a fever, as well as extreme itchiness of the eyes and of the nose. That's not typically seen with those other illnesses. But a cold and flu and COVID can all be very, very similar. And I think the message that I would send to parents is it's reasonable to watch a child who is developing those symptoms early on as those symptoms develop. Most symptoms like colds resolve within a matter of a few days, and even influenza resolves within 5 to 7 days, where COVID can last for a week or two. And so I think it would be very appropriate for a parent to watch the evolution of those symptoms for the first couple of days. If those symptoms are persisting, I think it's important to test. And one of the messages I would like to send out to your viewers is not to fear testing. That testing is going to be the only way that we're really going to be best able to track and follow this disease. The good news is that we've really seen a change in the technology for testing. The standard for COVID testing is still the nasopharyngeal swab, that big swab that goes all the way to the back of your head. But there's some new technologies that are available that are allowing testing through just a nasal swab, just an inch or two into the nose, very similar to a test that's done for RSV or influenza. And that's actually what we're using in our office as well, and it's less invasive. There are other tests that I've heard about but not used personally that are a swab in the cheek or the back of the throat, or even just a saliva test. And those tests have shown to be as accurate as the nasopharyngeal swab that was used 5-6 months ago and is still being used now. So I'm hopeful that most offices have access to these better tests that are less invasive, more comfortable, but still allow us to get an understanding of how this disease is spreading. So if there's any question of cold versus flu or COVID, the best answer is to make an appointment and get the test done.
Got it. And I think also it's probably important to make sure families know that when those symptoms start, it's probably rather be safe than sorry, and, you know, keep the kids home from school, or, you know, seclude them, make sure we're not out playing with our friends, you know, just until you know for sure.
Absolutely. Absolutely. I think that's really important too. That's what we can do for our neighbors and for our family and friends to protect them, is really trying to make sure these symptoms are resolving before exposing anyone else. And the other message too is, you know, when the test is pending, while we do have access to some rapid tests now, there's still a large number of tests that take a day or two before we get a result. And even if you're feeling better, I think it's going to be important for you to know you have the negative test before you go back to school or play groups or daycare.
Yes, thank you. I appreciate that. I think that's important. That's such an important message. So while we're on the subject of testing, let's kind of focus now on influenza. So when and I'm sure you would agree, one of the safest things that families can do is get a flu vaccine this season, correct? Absolutely.
Absolutely. Now as much as ever.
So when we're planning to get our flu vaccine for our family, is there a specific time frame you recommend? You know, I hear earlier is better, or, you know, I've also heard that you go later on you're too early, it loses its effectiveness. You know, is there a specific time frame you would recommend?
Well, it's a difficult question to answer, and it is a little bit of a double-edged sword. On the one hand, there is some reason to believe that the flu vaccine does not last forever, and that there is a wearing off effect of the vaccine. How long that is kind of depends on the patient and the patient's immune response. But typically it can be anywhere from 4 to 6 to even 9 months before the effect wears off. With that knowledge, you would think that the most appropriate time to get a flu vaccine would be ideally October or November, which would then effectively cover you during the peak months of influenza, which can vary from year to year, but is typically December, January, February, sometimes into March, sometimes as early as November, but December, January, and February tend to be the peak months. On the other hand, if you wait too long to get the flu vaccine, there's a concern that perhaps the supply of the flu vaccine may be low. And I think that's something some parents have encountered as well, that they wait until late November, early December, and the next thing you know, their pediatrician or doctor's office is out of flu vaccines for the year, especially this year where the flu vaccine is incredibly popular. The other concern, if you wait too long, is we never quite know when influenza will hit. So if you wait until Thanksgiving to get your flu shot, it's very possible that influenza may already be circulating in the community in early November or even mid-October. So the advice that I would give to parents would be, whenever there is the opportunity to get the flu vaccine, get it done. If you're in your pediatrician's office in September and the flu vaccine is available, get it there and then, because you never know when it might run out or when you might have other plans and you're not able to get back into your pediatrician's office. You know, and if you've waited too long and it's already January and you haven't gotten your flu vaccine, because we continue to see cases, I'd encourage parents to get it then as well, especially if we still have the stock and the supply in our offices.
So sooner is better.
Sooner is better. Get it whenever, get it whenever you can. If there's the opportunity, seize the opportunity. That way you'll know you're protected.
I love that. Now, speaking of this flu vaccine, you hear people say, well, I don't get the flu vaccine because it causes the flu. Does the flu vaccine actually cause the flu?
Well, I have a very definitive answer, and that's an easy question. The answer to that is no. No, the flu vaccine does not cause influenza. The flu vaccine is made in such a way that there is no virus that is actually in the shot. And so there's no way for you to be able to get influenza from the vaccine. The best example I can give you is the way the shot is made. Let's say that I wanted to immunize you to a zebra. Okay, we're going to use this example. I wouldn't put a zebra in the shot, but what I would do is I would take hair from the tail of the zebra, or maybe fur from the chin of the zebra, and I would put that in the shot. And then, as your immune system would ever see hair from a zebra, it would know to respond to that. That's essentially the way the flu vaccine is made too. There's no influenza, there's no whole flu in the vaccine. It's just parts of it that help your body's immune system to recognize it. So if it does ever encounter the influenza virus, it knows how to react to it.
That's really helpful information. Definitely.
So,
as far as statistics for the flu vaccine, what are some positive statistics you could share with us about the effectiveness or just the flu vaccine overall?
Sure. So a few things about the flu vaccine. I mean, the one thing that we do know, and admittedly so, is that the flu vaccine is not always entirely effective. Each year, the flu vaccine components change based on our understanding of the circulation of influenza in other parts of the world. For example, when we are experiencing our summer, the southern hemisphere, Australia, South America, are experiencing their winter. And we can look at the types of viruses that are circulating there, and we can predict then what we might see during our flu season. So we take those components and we put those into a flu vaccine, hopefully to be effective for what we're going to see. Unfortunately, though, the best we have been able to do in the last 10 years is about 60% effectiveness.
Okay.
Which isn't so great if you think about it. It's 4 to 10 chances that you won't be. Last year, the effectiveness of the flu vaccine was about 39%. And in the last 10 years, it's ranged as low as about 20% to as high as the 60% I mentioned. So that can be very discouraging. However, what we do know is that while the flu vaccine is not perfectly effective, we understand that getting the flu vaccine, while it may not completely protect you from influenza, it will protect you from becoming seriously ill. And it absolutely, without a doubt, prevents children and adults from ending up in the hospital with severe complications from influenza. We also know that getting the flu vaccine can shorten the course of illness. So rather than typically being sick for 5 to 7 days without a flu vaccine, you may only be sick for 2 or 3 days, which I think improves people's overall health and their ability to get back to work and get back to school. So despite those poor numbers, I'm still a strong advocate of the flu vaccine for those other reasons.
That makes sense for sure. So, well, Dr. Halter, I thank you so much for taking your time and chatting with us, because I think this is some really great information as we head into cold and flu season this year. And I learned so much, and it was very helpful. So I appreciate you taking the time with us today.
Well, great. Well, this was really enjoyable. I enjoyed it as well, and I really, really appreciate you having me.
Thank you. Have a great afternoon.
All right, you too. Bye.